Welcome to the Maternity Mentor. Today we will be talking about the common causes of bleeding during the first trimester and what you should do for your health and the health of your pregnancy. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I have received training in perinatal mood and anxiety disorders as well as perinatal bereavement. Bleeding during the first trimester can be very scary. All bleeding during your pregnancy should be brought to your healthcare provider's attention so they can determine the cause and provide you treatment. Let's explore what causes first trimester bleeding. When an egg has been fertilized, it must travel down from your fallopian tube into the uterus. Once there, the egg needs to attach itself or implant into the uterine wall. When this happens, some bleeding may occur. This is called implantation bleeding. It usually happens 10 to 14 days after conception or the fertilization of the egg. The bleeding may look like a light period, which can cause a woman to think she is not pregnant. Symptoms of implantation bleeding can include mood swings, headache, nausea, backache, and mild cramping. Implantation bleeding poses no risk to you or your baby. Most women will never call or visit their healthcare provider because they may not even realize they are pregnant. However, if you have unexpected bleeding, you should take a pregnancy test and contact your healthcare provider. Implantation bleeding may also occur in conjunction with a subchorionic hemorrhage, which is bleeding under the placenta of your baby. For more information on subchorionic hemorrhage, please see our video on this. We will link that in the description below. Cervical inflammation, or cervicitis, is when the cervix becomes inflamed and painful. This is often caused by sexually transmitted diseases, or STDs, including chlamydia, gonorrhea, trichomoniasis, and others. It can also be caused by allergies, irritation from inserted objects including diaphragms and sex toys, as well as cancer and bacterial imbalances within the vagina. Pregnancy hormones can contribute to cervical inflammation as well. A common symptom of cervical inflammation is bleeding. Other symptoms may include painful intercourse, gray and white discharge, pain in the abdomen or pain in the back, and vaginal irritation. It is extremely important to have bleeding caused by cervical inflammation checked out by your healthcare provider. For example, if the cause is an STD, early treatment must be started to avoid problems with your pregnancy, including miscarriage. For more information on sexually transmitted diseases during pregnancy, as well as sex during pregnancy, please see our videos on these. We will link those in the description below. Another common cause of bleeding in the first trimester is cervical polyps. Cervical polyps are usually non-cancerous bumps that grow on the cervix. They can be caused by inflammation of the cervix, high estrogen levels, and rarely cancer. Symptoms include foul-smelling vaginal discharge, bleeding after intercourse, and spotting. Cervical polyps can only be diagnosed by your provider looking at your cervix. Your provider will most likely remove them and biopsy them to check if they are cancerous. Cervical polyps are usually harmless and require no treatment. However, if they are cancerous, that can have significant impacts on your pregnancy. Cancer itself is usually harmless to your baby, but the treatment options can have negative effects, including birth defects and even miscarriage. You will need to discuss your treatment options with your provider and decide when and how you want to proceed. Before we continue, please remember to hit that like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about molar pregnancies. Molar pregnancies are very rare, occurring in less than 1% of all pregnancies. A molar pregnancy is a non-cancerous tumor that occurs after a non-viable pregnancy. They may also be called a hydatidiform mole. Symptoms include bleeding, cysts in your vagina, pelvic pain or pressure, and severe nausea and vomiting. Many women will be diagnosed by the symptoms. Your pregnancy tests will usually come back positive because the pregnancy hormone HCG will increase slowly. Bleeding with a positive pregnancy test will be cause for concern, so your healthcare provider will order an ultrasound. Ultrasound can be used to diagnose the molar pregnancy. After diagnosis, a D&C will be performed to remove the molar pregnancy. You will need to be monitored for up to a year to make sure your HCG levels return to normal. During this time, you will be advised not to get pregnant. This is because rarely molar pregnancies will continue to grow inside the uterus, leading to choriocarcinoma, a form of cancer that requires chemotherapy. Pregnancy can mask this life-threatening condition and delay receiving proper treatment. Ectopic pregnancy occurs when the fertilized egg implants outside the uterus. Most often the egg will implant in the fallopian tube, but it can also implant in the ovary or cervix. As the fertilized egg begins to grow, this can cause numerous symptoms. These symptoms include light vaginal bleeding, nausea, vomiting, pain on one side of your body, sharp, severe abdominal cramps, dizziness, weakness, and pain in your shoulder, neck, or rectum. Ectopic pregnancies are a medical emergency. Once implanted, a fertilized egg cannot be removed and placed into the uterus. Without the blood flow from the uterus, the pregnancy cannot survive for long. However, it can grow for a short time, which can cause the rupture of the fallopian tube or ovary when the egg gets too big. Treatment is needed immediately to save a woman's life. If detected early enough, mothers may be given methotrexate, a chemotherapy drug, to stop the pregnancy from growing. In some cases, the pregnancy is already ending, and close observation for the body's natural removal of the pregnancy is all that is necessary. However, many women will require emergency surgery, which can include the removal of the fallopian tube or ovary. All bleeding and pain during the first trimester should be brought to your provider's attention so they can investigate the cause and rule out medical emergencies. One of the scariest and unfortunately most common causes of bleeding during the first trimester is miscarriage. This usually occurs before 10 weeks of pregnancy. Miscarriage is the spontaneous loss of a pregnancy. Symptoms of miscarriage include pain in the abdomen, weakness, fever, weight loss, severe cramps, worsening or severe back pain, a pinkish white mucus discharge, and bleeding. Many miscarriages will occur after a woman has received a positive pregnancy test, but before she has seen her healthcare provider. If you think you are having a miscarriage, it is extremely important to call your provider or to head to the nearest hospital. Unfortunately, once a miscarriage has begun, it cannot be prevented. Some women will require a D&C to assist with the body's natural removal process. However, in some cases, the cause of the bleeding is something else that can be treated. That is why it's so important to get checked out when you see bleeding during your first trimester of pregnancy. You should always call your healthcare provider when you see bleeding during your first trimester of pregnancy. I hope this has explained the different causes of first trimester bleeding to help you better understand what is going on and why certain treatments are necessary for the health of you and your pregnancy. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.